to thank the City of Battle Creek and our partners and other municipalities, Marshall and Albion, Community Action Agency. I think we've taken a very cooperative, collaborative role in addressing lead as a significant issue within our community. As Chris alluded to, we average about 50 children a year that are test positive for lead in their bloodstream. That's 50 kids too many in my mind. We know that we test approximately 2,000 children a year annually within this community, and that's a coordinated effort through work at the health department, through work at organizations like the Head Start program, the Community Action Agency, our local physicians and such. And of those, we know that between 3 to 4% of these children come back with elevated blood lead levels. And again, our goal is to do a lot more testing over the course of the next, well, we've already begun more testing since June of this year. So knowing that, if we double the number of kids that we sample, or triple or even quadruple the number of kids that we sample, if we average 50 kids a year with EBL, which is elevated blood lead, we know that we're going to double, triple, and quadruple the number of positive elevated numbers that we see in these children. So it becomes more and more important that we address this from a collective manner. It is Lead Poisoning Prevention Week, and it's no coincidence that we're rolling this out in unison with that. We want to remind the residents in Calhoun County that our lead issues historically are not caused by waterborne incidents, as what we had found in Flint. Historically, our lead issues deal with housing stock, antiquated, outdated housing stock. We know that houses that were built prior to 1978 oftentimes contain lead. We know that dilapidated housing in Calhoun County plays a significant role in the contamination of kids. I know that there's houses in Calhoun County that time and time again have contributed to lead poisoning. So those are significant issues that, again, we need to deal with collectively. So the task force action plan includes the following 3 program areas. We're going to talk about the increased lead testing and reporting of children in Calhoun County. We have 3 goals associated with that. Goal 1 is to promote universal screening for elevated blood lead levels for all children under the age of 6 and increase the number of children aged 0 to 6 who are tested for lead blood poisoning, including children covered by Medicaid and those with private health insurance. So we know that, again, our primary objective is to test more kids. We've been able to secure several grants, one from the Albion Community Foundation and one from the Battle Creek Community Foundation, to be able to purchase additional lead analyzers, blood analyzers. So those 3 units are in place. We've got 1 in Albion, 1 in the city of Battle Creek, and then 1 that is roving. Will go to different locations. So again, we'll be able to really significantly increase the number of kids that are tested on an annual basis. Goal number 2 is to continue to engage families of children who have elevated blood lead levels to reduce or eliminate the long-term effects of lead poisoning. And again, this goes back to the reality of, if we're going to test more kids, we're going to find more EBL cases. So we need to be able to respond. Typically what happens when we identify a child that has elevated lead, a public health nurse will go out and we begin working with that family to eradicate the situation and assure that the levels are brought down to below 0. And then our final goal is to increase the reporting of testing by private physicians by implementing a countywide memorandum of understanding concerning communication, lead test results, and lead education between healthcare providers and the Calhoun County Public Health Department to ensure appropriate follow-up is taken for children with EBLs of 5 micrograms per deciliter, which is the same as parts per million. So we know that we are doing some testing, but we want, again, to do more. We want the primary care physicians to understand their role. We want them to understand the importance of testing for lead. We work with our partners at our Federal Codified Health Center, Grace Health. We work with primary care physicians. We continue to work with agencies like Community Action Agency to assure that we're doing our part and that we're testing as many kids as we can within that 0 to 6 age bracket.